Hello everybody, and welcome to the review of Chapter 8, Quality Control of Radiopharmaceuticals, in Saha's Fundamentals of Nuclear Pharmacy. This presentation on radiopharmaceutical quality control is given by Daniel Plemmel and Matteo Kajic. In this presentation, we will introduce radiopharmaceutical quality control, good manufacturing practices, good laboratory practices, physicochemical tests, biological tests, and record keeping. Because radiopharmaceuticals are to be administered to humans, quality control tests must be conducted to determine their safety. Several specific tests are used to determine the product's potency, identity, biologic safety, and efficacy. All quality control measures applied to non-radioactive pharmaceuticals must also be applied to radiopharmaceuticals, which require additional tests to determine radionuclidic and radiochemical purity. Quality control tests are often conducted by manufacturers throughout the manufacturing process, but increasing use of kits, short-lived radionuclides, and on-site preparation of radiopharmaceuticals require that most quality control tests be performed on in-house preparations. Quality control tests fall into two categories. There are physicochemical tests, which are used to determine the level of radionuclidic and radiochemical impurities, and to determine the pH, ionic strength, osmolality, and physical state of the sample, whereas biological tests are used to determine the sterility, apyrogenicity, and toxicity of the sample. Prior to discussing specific tests, we will overview good manufacturing practices. Good manufacturing practices are guidelines for manufacturing, testing, and quality assurance to ensure that products are consistently high quality and safe for human consumption or use. Many legislative bodies require that manufacturers follow minimum good manufacturing practice requirements or create their own which comply with those regulations. Rules that govern each industry differ, and individual products will have varying practices and processes, but the overarching goal is to provide consistent, contamination-free products whose manufacture is conducted by well-trained personnel with adequate documentation and quality control completed throughout the manufacturing pipeline. It is important to note that good manufacturing practice standards are not prescriptive, dictating a manufacturing process, but are performance-based requirements which must be met. Good manufacturing practice guidelines follow basic principles. Manufacturing facilities must maintain a clean and hygienic manufacturing area and a controlled environment to prevent contamination. Manufacturing processes must be clearly defined and controlled with critical processes validated to ensure consistency and compliance with specifications. Manufacturing processes must be controlled with any changes being evaluated. Manufacturing instructions and processes must be clearly and unambiguously written. Personnel must be well trained to conduct procedures and to document them. Records must be made which show that all required steps were completed and that the quality and quantity of the product was as expected, with any deviations being investigated and documented. Manufacture and distribution records must be maintained which allow a batch's entire history to be traced. Distribution practices must minimize impact on quality, and a system must be established for recalling a batch. And complaints and the cause of those complaints must be investigated with appropriate measures implemented which prevent recurring defects.
Good laboratory practices are controls to ensure uniformity, consistency, reliability, reproducibility, quality, and integrity of products in development for human or animal health through non-clinical safety tests. The principles of good laboratory practices aim to ensure and promote safety, consistency, high quality, and reliability of chemicals in the process of non-clinical and laboratory testing. Next, we will go over physicochemical tests that may be performed. It is very important for the user to be familiar with the physical characteristics of the radiopharmaceuticals they are working with. One should be familiar with the color, particulates, and clarity in particular. Deviations in the anticipated physical characteristics should be concerning, as the expected biological behavior may have been altered. The size of the particulates can vary considerably between batches, but particles larger than 150 micrometers should be discarded due to the potential for pulmonary arterial blockage. The radiopharmaceuticals must have appropriate hydrogen ion concentration or pH to be considered stable. Ideally, the pH of the solution should be similar to blood at around 7.4, but it may vary from 2 to 9 due to the high buffer capacity of blood. Radiopharmaceuticals must also have proper ionic strength, isotonicity, and osmolality if they are to be administered to humans. Ionic strength can be altered by adding a proper acid, alkali, or electrolyte. It is similarly important to use the correct diluent for radiopharmaceuticals, preferably the same solvent that was used in the original preparation. Radionuclidic purity is the fraction of total radioactivity in the form of the desired radionuclide present in a radiopharmaceutical. Impurities can be caused by extraneous nuclear reactions that can occur due to isotopic impurities in the target material. The purity is measured by identifying the half-lives and characteristic radiations. Gamma radiation can be measured using sodium iodide or jelly detectors, and beta emitters can be detected by using liquid scintillation counters or beta spectrometers. Half-life measurements are still necessary, and they are determined by measuring radioactivity at different time intervals, and they are plotted on a semi-logarithmic paper resulting in a straight line. Radiochemical purity is the fraction of total radioactivity in the desired chemical form in the radiopharmaceutical. Precipitation is used, and the precipitate is separated by centrifugation. For paper and instant thin layer chromatography, a small aliquot of the radiopharmaceutical preparation is spotted on a paper, otherwise known as a Whatman paper strip, or an instant thin layer chromatography ITLC strip. Chromatography is then carried out by dipping the spotted strip into an appropriate solvent contained in a jar or chamber. Some precautions to be aware of is that the chromatographic paper should be dry. You should avoid streaking of solvents along the edge of the paper strip, and the sample spot should be small and long. Air drying should be avoided to prevent air oxidation of the technetium chelate. For gel chromatography, the sample is spotted on the top of a column of Cephadex gel or Biorad gel, soaked in an appropriate solvent, and then eluted with the same solvent. It is useful in separating proteins of different molecular weights. Paper or polyacrylamide gel electrophoresis is the application of a radioactive sample on a paper or a polyacrylamide gel soaked in a suitable buffer, and then applying an appropriate voltage across the paper or gel for a certain period of time. Ion exchange is done by passing a sample of radiopharmaceutical through a column of ionic resin and eluting the column with suitable solvents. Solvent extraction is performed by having a solution containing one or more chemical compounds shaken with an immiscible liquid. The separation of different compounds is affected by the preferential solubility of individual compounds in one solvent or another. In high-performance liquid chromatography, a sample is injected by an injection valve or by syringe or sample or septum arrangement, and then the eluent is pumped into the column under pressure, up to about 6,000 pounds per square inch, at a precisely controlled rate using an electrical pump. A sensitive detector then monitors the concentration of various solutes in the sample. In distillation, the compound with higher vapor pressure is distilled off first, leaving the other compound in the distilling flask. Chemical purity is defined as the fraction of the material in the desired chemical form. Impurities arise from breakdown of material and interfere with diagnostic testing and could be toxic. Aluminum is an example of a common impurity in technetium eluate. Additives, acids, alkali, and buffers are not considered impurities. Purification of impurities is performed through precipitation, solvent extraction, ion exchange, and distillation. For radioassay, 10 CFR 35 requires that the dose calibrator be calibrated according to the manufacturer's recommendations or nationally recognized standards. These tests include a daily constancy test, an annual accuracy test, a quarterly linearity test, and geometry tests after repairs have been performed. Constancy indicates the reproducibility of measurements by a dose calibrator, and it is done by measuring activity of long-lived radionuclides. Accuracy testing is done by measuring the activities of at least two long-lived reference sources at their respective isotopic settings and comparing the measured activity with the stated activity. The results of this testing must be within 10% of the anticipated results. Linearity indicates the dose calibrator's ability to measure the activity accurately over a wide range of values. In the decay method of linearity check, a source of technetium-99m is usually used, the activity of which is at least equal to the highest dosage normally administered to patients in a given institution. In the geometry test, variations in sample volumes or geometric configurations of the container can affect the accuracy of measurements in a dose calibrator. This is because of the attenuation of radiations. Correction factors must be applied if the difference in activity exceeds plus or minus 10%. Radioactivity is measured by placing the sample inside the dose calibrator with the appropriate isotope selector setting. Low or diluted high activity samples can also be measured in a well-type sodium iodide counter.
Biological tests are used to determine the sterility, apyrogenicity, and toxicity of radiopharmaceuticals prior to human application. These tests are the same as those used for traditional pharmaceuticals. Sterility is the absence or dearth of bacteria and other microorganisms in a radiopharmaceutical preparation. All preparations used in humans must be sterile and sterilized. Autoclaving is sterilization of the radiopharmaceutical using hot steam at 121 Celsius, 18 psi, for 15 to 20 minutes. This method is only suitable for aqueous solutions stable at high temperatures. Oil-based and heat-labile radiopharmaceuticals are damaged by heat. This method also takes too much time for short-lived radionuclides such as nitrogen-13 and fluorine-18. Technetium-99 pertechnetate, indium-111 DTPA, gallium-67 citrate, and indium-111 chloride are thermostable radiopharmaceuticals for which autoclaving is a suitable sterilization method. Dry heat sterilization and perhaps photon irradiation are also viable sterilization methods for these compounds. Shown here is one example of an autoclave, but other systems look like a typical pressure cooker like you might see in a kitchen. Autoclaves have a thermometer and pressure gauge. The most common sterilization method for radiopharmaceuticals is membrane filtration. With this method, the radiopharmaceutical is passed through a filter of known pore size to filter out microorganisms. Disposable units with various known pore sizes are available, with the most common being 0.45 micrometers. For samples suspected to be contaminated with smaller microorganisms, and for samples to be used in the blood, a 0.22 micrometer filter is required. This method has the advantage of being useful for short-lived radionuclides and those sensitive to heat. With small volume preparations, a filter is simply fitted to the end of a syringe and the preparation is pressed through it into a sterile container. Radiopharmaceuticals are tested to prove that they are sterile or free from viable microorganisms. This must be done aseptically to prevent the introduction of microorganisms during testing. A sterile laminar flow hood helps to accomplish this, and personnel must be well trained. One method of testing sterility is incubation of a dose volume or greater in fluid thioglycolate medium at 30 to 35 Celsius for 14 days, or in a soybean casein digest medium for 14 days at 20 to 25 Celsius. If any bacterial growth is observed, the sample is not sterile. For short-lived radioisotopes, this method must be done after administration. In these cases, the manufacturer will already have established the product's sterility during the production process. Another method of testing sterility relies on the metabolism of carbon-14 glucose by microorganisms. A test sample is added to a trypticase soy broth culture medium containing carbon-14 glucose. The sample is then incubated, and the carbon-14 carbon dioxide is collected and measured with a gas ionization chamber. This test can be performed using an automated instrument and only requires 3 to 24 hours, which is significantly less time than other sterility tests. The soy broth pictured here is just a generic image and is not necessarily the medium used in this test. Pyrogens are substances which can cause fever and or other symptoms when introduced to the blood and body. Pyrogens are often the product of bacteria, but other chemicals are also pyrogens. A sterile preparation may still be pyrogenic, and sterilization does not destroy pyrogens. There is no specific method that guarantees apyrogenicity, but because the primary source is bacteria, using sterile equipment under aseptic conditions during preparation is the best way to prevent pyrogen contamination. One method of testing for pyrogenicity is the USP rabbit test, where 3 rabbits of at least 1.5 kilograms each are injected with at least 1 human dose per kilogram of test sample. 3 to 10 times dose is often used for additional safety. Their temperatures are measured at intervals for 3 hours. If the individual's temperature does not rise more than 0.6 Celsius or a total combined increase of less than 1.4 Celsius, the sample passes the test. If the sample fails, the test must be repeated with 5 more rabbits. If no more than 3 of the 8 show a temperature increase of 0.6 Celsius or more, and the sum temperature increase is less than 3.7 Celsius, the sample is considered apyrogenic. Another test for apyrogenicity is the bacterial endotoxin, or Limulus amoebocyte lysate LAL test. This test is used to detect and quantify the presence of endotoxin-type pyrogens. When the sample is incubated with LAL at 37 Celsius, within 15 to 60 minutes, an opaque gel will form, with thicker gel indicating a higher concentration of pyrogens. This test is available as a kit and available commercially. As with any other drug, the toxicity of radiopharmaceutical drugs must be established. Toxicity can result in altered organ function and can even cause death. Tests for acute and chronic toxicity are done by administering the substance to animals including mice, rats, rabbits, and dogs over a period of 2 to 6 weeks. The animals are killed at varying time intervals, and an autopsy of their organs is conducted to observe pathologic changes. The LD 50-60, or lethal dose to 50% of a population within 60 days, is determined by testing large groups of animals of at least 2 different species. The toxicity from radiopharmaceuticals is usually caused by the pharmaceutical itself, not the radioisotope. Toxicity is increasingly modeled using computer models and cell cultures rather than with animal testing. Record keeping is an essential and legally required component of quality control. It is used to trace the faulty preparation of a radiopharmaceutical should an adverse result occur, such as a low-quality scan. There are various ways of keeping records, but the entire history of a radiopharmaceutical should be documented to help trace the cause of any deviation from the expected result of administration.